Hi, Dr. Bhatia here. Hope wherever you're watching this video, you're keeping safe and healthy. Today, I want to talk to you about new information that's come out through the Canadian Mental Health Association regarding access to care right now, mental health care during the COVID-19 pandemic. As we've been talking about here, and all of us to varying degrees have been experiencing a lot of distress, anxiety, depression regarding living in this COVID-19 quarantine. What their data found at the Canadian Mental Health Association is when they polled Ontarians who identify with having a mental health condition, only 13% of them who did identify with a mental health condition were seeking out help. In contrast, prior to COVID-19, 39% of people with mental health conditions were reaching out for mental health supports. So that means there's been a reduction by 2/3 of people who have been reaching out given that sample. And this is quite distressing, because obviously when we have mental health issues, that's the time we have to reach out. But what we also know with mental health conditions is that when we are facing increased levels of stress and anxiety and depression, paradoxically, one of the symptoms and fundamental features of depression or anxiety is that it paralyzes us or demotivates us and gets us deeper and deeper into our mental health turmoil. And what I'm encouraging you out there right now, those of you who are struggling and are not seeking out help, that I know how hard it is, I know how difficult it may seem, but having the ability to just reach out, whether it's talking to a friend, going online to look for support networks or resources, picking up the phone and calling a psychologist office. We are all offering mental health services through video and telephone. There's support out there for you. So I know it's really hard right now, but I'm strongly encouraging you to try to find a way to reach out. Also, those of you right now who are in a situation where you're living with someone or know of a friend or a loved one who is struggling, reaching out and talking to them, checking in, letting them know that you're here for them, that you're here to support them, and that there is help out there. We also know that therapy works. The same data suggests that of those 13% of people who reached out during COVID-19, 77% of them indicated that they found the reaching out for help to be supportive, reducing their stress, and to be helpful. So we know mental health treatment can be effective and can help reduce a lot of distress. I'm also encouraging people out there who may not identify with a mental health condition, that are just struggling with stress and anxiety, to reach out to get support as well. So all in all, my main message here today is that if you need help, there is help, and you're not alone, and we can get through this together. Thanks, and I'll talk to you soon.